Hello there, my name is Dr. Sida Ikanem. Welcome to my channel. I am a obstetrician and gynecologist in training, and I make content on all things women's health and fertility. If you're new to this channel, you're very welcome. I want you to do the following: leave a thumbs up, subscribe to this channel, and stick around for more. Doctor, I don't want to have a cesarean section. I know a friend who had a cesarean section some years ago, and she has not been able to conceive afterwards. This is just one of the many myths surrounding cesarean section. So let's talk about it. What is expected in cesarean section and what is not? If it sounds like something that would interest you, I want you to stick around so that we'll get right into the topic of discussion. All right, thank you for staying tuned in. Speaking from my context as a Nigerian trained medical doctor, I have encountered a lot of women who have very wrong information about what cesarean section is about, and because of that, they make decisions that are usually harmful to their health and to that of their baby. Cesarean section is actually just the delivery of the baby through the abdomen. However, what is conventional is delivery of the baby through the vaginal tract or the birth canal, through the vagina or the birth canal. Cesarean section has been found to be a very life-saving technique, improving the outcome of not just the mother but just the baby. So, why why is there so much misunderstanding, or why is there so much reservation about cesarean section? Most of these reservations stem from our culture or stem from beliefs that have passed on from generation to generation. Yes, many women can be delivered by cesarean section, but cesarean section is not needed for all women. Now, cesarean section is usually offered when there is a clear indication or reason why a woman cannot deliver through the birth canal. At this point, let me make this statement clear. I hear a lot of people say, "Oh, how did you deliver? She had a normal delivery." With normal delivery referring to the fact that she had a delivery through the birth canal. Then that goes to show that now therefore implies that the cesarean section is a normal delivery. Let me correct this notion. Whether a vaginal delivery or a cesarean section, both are proven methods of delivering a baby, and none is considered normal or the other abnormal. All right. Having made that clear, let's look at why a woman would need a cesarean section in the first place. Because two people are involved in the birth process, the mother and the baby, it means that the mother or the baby, factors concerning the mother or the baby can influence the decision for delivery. Let us look at the factors surrounding the baby. All right. A woman would require cesarean section for the following reasons. One, if she has a baby that is if there's malpresentation just means that the baby is not positioned with the head down. Rather, the baby has other parts of the body presenting in the lower aspect of the womb, for example, the shoulder or the buttocks. This is a reason why cesarean section will be recommended. Another thing is if it's a twin pregnancy with the first twin presenting with any other part of the body apart from the head. So, in this case, a cesarean section is the safest mode of delivery. Another reason why a woman would need a cesarean section is if she's having a baby that has a congenital anomaly or a congenital defect. The baby passing through the stress of labor is usually would not be recommended in this regard. Another reason why a woman would have a cesarean section is if the baby is having unstable vital signs during the process of labor. This is what we call a fetal distress. In this case, in order to save the life of the baby, emergency cesarean section is usually recommended for this baby. Now, these are just some of the few indications where a woman would require a cesarean section when the baby is involved. Now, let's go and look. Let's go ahead to the mother now. One of the major reasons why a woman would require cesarean section is if there is a misfit between the baby's head and the mother's pelvis, the mother's pelvic bone or birth canal. And usually we see that in first of all in a very big baby, fetal macrosomia. That's when the baby is really big, okay, and it will be harmful for the mother to deliver the baby through the birth canal. Then a cesarean section may be recommended. Other factors pertaining to the mother will include the location of the placenta. If the placenta is located in the lower part of the womb, it just means that the birth canal has been obstructed and it would not be safe to have a vaginal birth or in delivery through the birth canal. Another reason why a woman would have a cesarean section is if she has been in labor for a very long time. She's having a difficult labor, having very prolonged labor, or she's not progressing, she's not dilating as she should, then a cesarean section is recommended and very early. Also, if a woman encounters bleeding during labor, without delivery of the placenta or before delivery of the placenta, it is an emergency and a woman therefore would need cesarean section as soon as possible to save her life. Other situations or conditions where a woman will require cesarean section is like hypertensive disorders that are occurring in pregnancies and are life-threatening. If a woman is having diabetic in pregnancy with a very big baby, fetal microsomia, then a cesarean section is indicated. For women who have been treated for fertility or for women who are getting pregnant for the first time at ages greater than 35, usually it's recommended that they do a cesarean section just because just to circumvent the stress and the uncertainties that sometimes surround the labor process. Okay, so for women who are in this category, if your doctor suggests that you have a cesarean section, please do well to consider because it's actually a better option for you to deliver a very sound and healthy baby. There are so many other reasons I could go on and on and on and on about why cesarean section are important. So you can see the cesarean section has been found to be actually a very life-saving delivery method. Okay, and it has been proven to improve the outcome for the mother, to improve the outcome for the baby. Reasons why a woman would require cesarean section is if one, she's HIV positive and her viral load is not under control. To prevent the transmission of HIV from her to the baby, the cesarean section is recommended. If she's having active genital herpes with florid lesions, on the around the vulva area, it is not recommended for a woman to have a cesarean. No, sorry, it's not recommended for a woman to have a vaginal delivery in this regard. For women who have coexisting abdominal tumors like uterine fibroids that are occupying the lower aspect of the womb, these fibroids can actually block the birth canal and make delivery extremely very difficult. For women who have very short stature, okay, and who we can tell that their labor is going to be obstructed or prolonged, it is best that they have a cesarean section as the preferred mode of delivery. All right, so for women who have had a previous delivery before, but because of complications, they sustained a tear in their womb, the best and safest form of delivery in subsequent pregnancies, if it is recommended or if it's possible, is to also have cesarean section.